For National Homelessness Awareness Month, we caught up with Chris Roesel, Program Manager of the Homeless Outreach Street Team at Integral Care. Can you paint a picture of homelessness in Austin and how HOST fits into the response?
Yeah, absolutely. So homelessness is a super complex issue. There are people experiencing homelessness. Maybe they are couch surfing with friends or family, but they're having to find new places. Sometimes they run out of places to stay, and then they might end up living in their vehicle. Sometimes people are evicted and they're brand new to the street. Sometimes people have been living on the street for many years. We call that chronic homelessness. With the Homeless Outreach Street Team, we are geared towards helping people who are experiencing chronic homelessness, people who have been on the street for a long time. That said, we encounter people who have any stage of a homelessness experience. We'll try our very best to connect anybody to the resources they need to help resolve their homelessness. But our main work is with individuals who are on the street for a long time, who are experiencing maybe some more difficult relationships with mental health, substance use, or medical issues.
Is there a connection between homelessness and mental health or substance use disorders?
Yeah, absolutely. There definitely are connections among the people who are experiencing homelessness. The severe, persistent mental health disorders are definitely overrepresented in that population, as are substance use disorders. People who maybe experience psychosis, maybe they have a diagnosis of schizophrenia, sometimes bipolar disorder or schizoaffective disorder. Their way of thinking might change when they develop that disorder. And sometimes people just really withdraw from their families. A lot of times their families might seek assistance for them and really struggle to get them to engage in treatment. Regarding substance use disorders, I know that among the general public, there's a view that that's maybe a driver of homelessness. However, I will say a lot more people fall into substance use after they hit the street. It is often a way to cope with being unsheltered. People who are on the street are a lot more likely to be victims of violent crime in particular. A lot of people are fearful to fall asleep when they're on the street. By taking drugs, it can help them stay awake. And it can also help them forget about all the trauma and the horrible situation that they're experiencing. We are helping connect them to mental health services with Integral Care, helping get them into hospitals if necessary, or getting them into one of our crisis respite facilities, helping connect them to medications. And then for substance use, working with the community health paramedic team, where we will connect people to Suboxone on the street, medication-assisted treatment, and then refer them into one of the clinics here in town, either through Integral Care or through community care.
We hear a lot about affordable housing. What is the connection between that and homelessness?
Well, it is very expensive to live in Austin. That makes people more prone to being evicted. We encounter people who hit the street for the first time. We encounter people who have been on the street for a matter of months, and the longer their homelessness experience goes, the more difficult it ends up being to resolve. We do work with a lot of people who are receiving disability benefits. Maybe they're on SSI or SSDI. Then they're receiving a maximum benefit of roughly $900 a month, which isn't going to get you very far in Austin. It's pretty difficult to navigate that landscape, and people really need assistance because it is difficult to find affordable housing, and there's just not enough of it.
We're rolling into the holidays and cooler weather. What are some ways we can support homeless neighbors?
Yeah, well, the first thing we think about when the weather starts to get cooler is safety. Obviously, when the weather goes below freezing, people can get hurt or die on the street. And so whenever the temperature is forecasted to go below 35 degrees, the city will open up their cold weather shelter system. There's a single point of departure where people will check into 505 Barton Springs Road whenever the cold weather shelters are activated. To verify whether they're activated on a given night, you're welcome to call the host hotline at 512-804-3720. There is an option on there for you to get connected to the cold weather shelter hotline. They'll update that message nightly. Whenever cold weather shelter is activated, there will be instructions on where people can go and what time to be there. Regarding what people can do to help out during the holidays, I know a lot of people like to help out their unhoused neighbors, especially during the holiday season. I'd recommend y'all reach out to one of the homeless navigation centers here in town. There are 3 in particular that serve a ton of unhoused clients with meals, clothes, all sorts of services, and those are going to be the Sunrise Navigation Center off Manchac and Ben White, Trinity Center off of East 7th and Trinity downtown, and then the Charlie Center, which is off 183 closer to McNeil. Reach out to them, check their website, see if there's a phone number you might be able to connect with them on.
Thanks, Chris. Remember, Integral Care is available for you anytime, day or night. Call our 24/7 helpline at 512-472-4357.